I'd like to ask your permission to use this video for educational purpose on the internet.
Yes,
We met 4 months ago regarding your neck situation,
correct.
and I'm going to just turn around and show that this is not a trivial thing. It's just quite tremendous, what we call spondylolisthesis 3, 4, 4, 4, and significant disc disease and herniation and stenosis in the 5 to 7. What were your symptoms last time we met?
Pain,
Yeah.
stiffness.
How bad was the pain?
I would say at least a 6. At least a 6.
Every day?
Yes,
Activity made it worse?
yes.
Oh, yes.
I was, yeah.
Yeah. Now, what do you remember what you and I talked about last time?
We talked about that you could fix it, but you thought that I should go to physical therapy and Dr. Savannah.
Okay, to
For
get
pain management.
Pain management.
Correct.
And now I put these pictures in our society. We talked about that, and some of our surgeons said I should go and do a C2 to T2 surgery, meaning from the back, go all the way from cervical to the thoracic. That's almost like a 7-level fusion and so on. And some people as well said I should go from the front to from C3 to C7 and so on. All of them big surgeries. But my conversation with you was, first we are going to maximize non-surgical treatment, and only if that fails, then I would be going most likely fixing only 2 of the discs for you. Remember that conversation?
Yeah, like 5 and
5 and 7.
7.
Because your symptoms mostly corresponding to those levels. Now, do you understand, or did I explain to you why? Because the symptom were in your fingers,
Yes.
corresponding to that more. Did you understand why I wasn't offering you that humongous surgery from the back or fixing them all from the front? Did it make sense to you then? What do you remember?
I believe it made sense that I have learned from having the big fusion below that a fusion is not the fix.
Well,
I mean, it is a fix, but there's consequences.
Yes,
And
no surgery come free of risk, no surgery come with a guarantee of any kind at all. Correct.
No, and I mean, from having L2 to L5 and then both of my SI joints, I've just realized that, to me, fusion is the last resort.
Yes, it is.
For the pure and simple fact, I've had to learn to walk differently. I mean, you have to learn to move differently, because if you don't, there's consequences that sometimes are worse than before.
So what are we going to do for the neck now?
Well, I had the nerve ablation,
Okay.
and my pain is maybe a 3. So at this time, I'd like to wait
Yes.
and see what happens. And if it gets worse, then I'll come back and then we'll fix me.
Exactly. So our plan is, even though some people suggested 5 or some people 7-level fusion, and so our plan is to do no surgery at all.
No.
Because your symptoms are getting better with conservative management, and by strengthening the muscle in the neck, by not doing excessive things, there is a good chance that we can avoid the surgery altogether. That it's not 100%, but I think if we can manage the symptoms without the surgery, as you said, surgery is always on the bottom of the list, not on top of the list.
I can live with 3.
Yeah. Okay. Well, and so can I, as long as you have the pain and not I. But you tell me which direction we are going based on your symptoms, not on how the picture look like. And if you have to do the surgery, my take on that is always smallest possible surgery then that can give you maximum benefit, rather than one big humongous surgery, because we can always go back.
Yeah,
But
I would not allow you to do
Yes,
a big surgery, to be honest.
that is a good, and you're in charge. Okay, thank you. I appreciate that.
Yes.